In the world of human intimacy, there are questions that most people are too afraid to ask, yet they silently carry them like a burden that affects their self-esteem, their relationships, and their quality of life. Imagine the weight of being in a moment that should be filled with passion and connection, but instead, your mind is racing with doubt. You think about whether your body will respond, whether you will disappoint yourself or your partner, and suddenly the room feels heavier, the moment fractured. This is the silent reality of sexual dysfunction, and it is where tonight's journey begins. I am Dr. a good urologist, pelvic surgeon, and your guide into the truths and myths surrounding sexual health. On this stage, under the cold light of fact and the warm light of human experience, we confront the science and the emotion behind one of the most intimate human experiences, the strength of an erection, the specter of erectile dysfunction, and the hidden effects of modern medicine like SSRIs on our sexuality. This is not a conversation to shrink from. This is an HBO story about science, humanity, and the courage to face what lies beneath the surface. The first question we explore tonight seems simple, but it hides a web of complexity. How is the strength of an erection measured? In medicine, there is a scoring system. And though it sounds clinical, it is the very foundation upon which researchers and doctors have studied this subject for decades. It's called the erectile hardness score. It is not about vague feelings, but about structured levels. At grade 1, the erection is not hard enough to penetrate. At grade 2, penetration is possible, but the erection lacks full firmness. At grade 3, the penis is hard enough for intercourse and mostly rigid. And at grade 4, it is completely rigid, hard, unyielding, the kind of erection that leaves no doubt. These categories have been used in studies to quantify a phenomenon that, for individuals, feels deeply personal. Yet here is the truth. Beyond the numbers, it is subjective. Only you know what your hardest erection has ever been. Only you can say if today it feels less firm, more firm, or unchanged. Doctors, like me, care about one critical line: whether it is hard enough for intercourse. But patients want more. They want the maximum, the peak, the kind of firmness that leaves them confident and reassured. And here lies the unsolved mystery. Does science know at what exact point a partner notices a difference? The truth is, no. No study has carved that line in stone. What matters is honesty with yourself and communication with your doctor. If you can say it feels hard, but not like it once did, or it is mostly hard, but not completely, you are providing the language we can work with. Technicalities aside, the goal remains simple: to restore satisfaction for you and your partner, to ensure the act of intimacy is not clouded by fear or disappointment. But how do we determine erectile dysfunction formally? Here, medicine offers another tool: the questionnaire. It is not long, usually 5 questions, but it digs into the heart of the matter. Do you feel confident in your ability to get an erection? How often is your erection firm enough for intercourse? How often do you maintain it to completion? Each answer earns a score, and that score paints a picture. High scores: no dysfunction. Slightly lower: mild. Drop further: moderate. At the lowest: severe. The chart can feel cold, the scoring detached, but again, behind the numbers lies the lived experience of a person asking themselves, am I satisfied? Is my partner satisfied? That is the core, and that is why we as doctors never stop at numbers. We dig deeper, because sometimes the cause is written in blood flow and nerves, and sometimes it is whispered in the recesses of the mind. This brings us to the next shadow that falls across intimacy: depression and the medications used to treat it. SSRIs, or selective serotonin reuptake inhibitors, are lifelines for millions. They ease the crushing weight of depression. They stabilize storms of anxiety. They give people back their days. But often, silently, they steal from the nights. Patients come to me with lowered libido, with erections that falter, with orgasms that drift out of reach. Women find climax difficult. Men find firmness unreliable. The dose matters at lower doses. Some glide by without issue. But at higher doses, side effects creep in. It is a trade-off, a balancing act between mental stability and sexual vitality. And the cruel irony is that in the very moment a person is feeling mentally stronger, their body may betray them in bed. What then? The answer is not silence. The answer is conversation. Talk to your psychiatrist. Talk to your primary care doctor. Tell them, since I started this, my body feels different. They know these side effects. They are trained to navigate alternatives. Sometimes it is a lower dose. Sometimes it is switching medications. Sometimes it is introducing strategies to mitigate the impact. But none of it happens if you stay silent. This is your body, your life, and you must be the quarterback of your own health team. And here we must pause, because there is a larger issue at play. How do you manage multiple doctors when your care crosses specialties? In this modern age, patients often see different specialists, and their conditions overlap like threads in a tangled web. A urologist may see one piece, a psychiatrist another, a primary care doctor the third. But communication is fragile. Sometimes it is a phone call between colleagues. Sometimes it is a letter, a note, a message through an electronic portal. In an ideal system, like the VA hospitals where I have worked, every note is accessible to every doctor, messages flow instantly, and a patient's story is clear to all. But outside that system, it can be fragmented. That is why I tell patients this: you are the keeper of your story. You have a right, legally and practically, to your records. Access them, read them, print them, share them with your other doctors. Do not assume one knows what the other is doing. Bring them into the same room, even if that room is only the folder in your hands. And if you feel lost, remember that your primary care doctor should be the one connecting the dots, referring you, making sure the web of your care does not unravel. Now step back and see the pattern. Sexual dysfunction is rarely just physical. The mind and the body dance together. When you struggle in bed, it is not only your blood flow or your nerves, it is your thoughts, your fears, your memories of failure, your anticipations of the next attempt. The weight of it sits on your chest even before the lights dim. That is why I recommend, whenever possible, to see a sex therapist or a psychologist who specializes in sexual health. They are not just for those with trauma or deep-seated issues. They are guides for anyone caught in the cycle of stress and failure. Stress and failure. But I know not everyone has access. Insurance, stigma, comfort levels all can stand in the way. Still, even if you cannot see one, remember that your mental health and your sexual health are inseparable. You cannot fix one without acknowledging the other. And so tonight, in this HPO story, we stand at the crossroads of science and humanity. On one side, the cold clarity of scores and scales, erectile hardness from 1 to 4 questionnaire that slot dysfunction into mild, moderate, or severe medication lists with side effects printed in fine lines. On the other side, the raw humanity of it all, the sigh of a man who feels less than himself, the quiet worrying of a partner who does not know what to say, the frustration of a patient caught between needing his antidepressant and losing his sex life. These two sides must meet, must merge, because that is the only way to truly heal. So what is the message I leave you with? It is this: do not suffer in silence. Erectile strength can be measured, dysfunction can be categorized, but the real measure of success is not in a score or a chart. It is in your satisfaction, your confidence, your connection with your partner. If you are not happy, if your partner is not happy, then it is time to talk, to seek answers, to bring your story into the open. And when you walk into a doctor's office, do not hand them fragments of your life. Bring the whole story. Bring your records, your experiences, your questions, your courage. Because in the end, the most important truth is simple. Your health, sexual, physical, psychological, is worth fighting for. And with that, I thank you for joining me tonight. If this conversation has opened a door for you, step through it. Do not close it again. Seek help, seek answers, seek connection. This is your life. This is your intimacy. And you deserve to live it fully.